Okay, I'd like to call the extra meeting of the Board of Health, which was asked for last Wednesday. And our job today is to really look at the data points, and see where we are in regards to the mask ordinance in the city of Nashua, and if or when we may be able to amend that. So Bobby, if you could kind of give the legal mumbo jumbo that we need to say.
Great. Yes, thank you, Dr. Stern. So today is January 19th, and this is our special board meeting that is held on location at 18 Mulberry Street. We also have the ability for the public to listen only and via Zoom or on site. The meeting ID is 882-1399-1371. The passcode is 170985. This meeting can also be joined by telephone 1-646-876-9923. If anyone has any problems with the audio, they can dial 603-821-2049. And that's it.
Thank you, Bobby. We have a quorum. All three doctors are here. I'd like, Bobby, do you have, would you like to introduce our guests who will be presenting information from the two hospitals?
Yes, I will. Dr. Sturz.
Thank you.
All right. So we have with us this afternoon, we plan to provide a situational update so we can understand where we are currently with the number of cases. And then we'll hear a presentation from Dr. Tim Shearer, who is the Chief Medical Officer at Southern Medical Center, as well as Allison Madden, who's also the Chief Medical Officer at St. Joseph, to do a presentation on what's happening in our hospitals prior to our discussion on the mask mandate.
Okay. Do we have also some statistics that you put together, Lindsay? You got it?
Yes.
Would you like to present them first, please?
Yes.
Thank you.
So I'm going to be presenting New Hampshire numbers and the national numbers for COVID-19.
So you're gonna have to speak up.
So for New Hampshire, there was a total of 250,581 total cumulative cases since the beginning of the COVID-19 pandemic. Over the past week, since January 11th, there was a 10.8% increase in total cases in New Hampshire. There are currently 20,045 active cases in New Hampshire. According to WMUR, this past week, there were 12,997 new cases over the weekend, and Saturday alone had 5,511 new cases, which is the record high in New Hampshire for a single day. According to Dr. Chan, this past Tuesday, he reported that the number of cases is 3 times higher compared to last winter and our last surge last year. There are currently 409 hospitalizations, 2,085 cumulative deaths since the beginning of the pandemic. And for vaccination rates, there is 56.1% of New Hampshire residents are fully vaccinated, and 62.7% have received at least 1 dose. For Nashua numbers, there was a total cumulative case count of 18,221 from about a week ago. So in the case where cases were updated yesterday, a week before then was January 11th, there was an 11.7% increase in case count. In Nashua, there is 1,487 cases that are active. There is a 29.5% positivity rate for the last 7 days and 127 cumulative deaths since the beginning of the pandemic. There have been 5 new deaths in Nashua alone since the 11th. There are 27 active cases being reported in the Nashua schools, with 4 clusters within the schools being reported. There are 3,696 new cases per 100,000 within the last 14 days in Nashua schools. As for vaccination rate in Nashua, there is 53.6% of Nashua residents fully vaccinated and 60.3% have at least 1 dose. And that's it. Great, thank you.
Thank you very much. Bobby, do you have anything to add? Any statistics, data points?
Well, just with what we're seeing, Omicron is the predominant variant currently that we're seeing worldwide, as well as nationally, with over 334.7 million cases worldwide now, and 5.6 million deaths being presented, as well as nationally 67.6 million cases in the United States, with over 857,000 deaths being reported. We know that over the past 2 years, with the COVID-19, that we've seen increases in our number of cases. We're starting to see increases that are now going across our demographics, with 8 different age groups being impacted, as well as the large number of individuals that are in our school systems that are being impacted as well. We instituted the mask mandate at the end of December, with the hopes of the month of 30 days afterwards, because we expected that there was going to be an increase in cases, to use the mask as another one of the tools that we have in our armament to slow down the impact of COVID on our most vulnerable populations, and to decrease the impact that these increased cases will have on our hospitals. Lindsay just shared the high number of cases that occurred over the weekend and what we're seeing right now in the state, which is definitely going to have an impact on our hospitals. And so the chief medical officers have been invited to give a presentation on what they're experiencing, with the hope that as we continue in this conversation, we'll see the importance of maintaining our recommendation for the mask mandate to, again, along with vaccinations, social distancing, with the washing of the hands, with people getting their boosters, that doing all these things together,
During my meeting.
decrease the impact and what we're seeing in our communities.
Would you like to present?
Sure. Thank you. Good afternoon. I appreciate the opportunity to share our experiences with you. Today, we have a high watermark for Southern New Hampshire Medical Center for the number of patients admitted with COVID-19. We have 46 COVID positive patients, 2 PUIs, and that is second only in the state to Elliott Hospital currently right now. Of those patients, about 39 of those are in our medical surgical beds, which we have decreased beds available due to staffing constraints. It represents approximately 40% of our inpatient medical surgical capacity currently. Our ICU is an 11-bed ICU that we've had to expand up to 17 beds, 16 of which currently are occupied. 9 of those patients are COVID-19 patients, which equals about 55%. So a significant portion of our inpatient capacity from the med surg side and the intensive care unit side are occupied by COVID-19 patients. This translates into difficulties moving patients into the hospital. It's also a challenge to move these patients out of the hospital because of their COVID status. And consequently, we have a logjam in the emergency department, which winds up creating long waits for our patients. And so when they come into the waiting room, they may be waiting 6 to 8 hours. And one of the metrics that we use for that is how many patients get frustrated and just leave. And we're consistently between 10 and 20% of our patients who show up to the emergency department leave out of frustration. So currently, we also have about 80 staff members who are affected with COVID. And that's after the fact that we've changed our return to work restrictions from 10 days down to 7 days, as long as they are feeling better, mild symptoms, no fevers, nausea, vomiting, diarrhea. We're bringing them back early because we need the staff to be able to care for the community. So currently, I would say that our operations are highly strained. We're doing the best that we can, and certainly it is causing frustration in the area of the emergency department. So that's the current status at Southern Hampshire Medical Center.
Thank you.
Dr. Madden, can you talk about something?
Yeah.
Sure. So pretty much what he said, just on a smaller scale, but it is very concerning, the staff shortages and the long waits for patients to get in is impacting people, whether or not they have COVID, inability to get procedures done because I don't have anesthesia providers or nurse is impacting patients' health. And it's not directly COVID related, but it is affecting their health. And that is a concern. Getting patients out, many of the nursing homes are closed, rehab's limited, and so that is a big challenge that we hadn't dealt with in quite the same level before. Currently, right now, we have 25 patients in-house with COVID. We've had higher than that. It's usually 25 to 30% of our volume is COVID. And currently, right now, I believe we have 28 employees out. That's actually very low for us. We've been up in the 38, 40 kind of range, which impacts our ability to function every day.
May I ask a question?
Sure.
Do either of you see an end in sight? Do you see this as being?
Don't you better have to speak.
Oh, so I'm sorry. Do either of you see an end in sight? Do you see a downward trend? Do you feel that we're turning a corner? Any of that?
I have hope that we are. I haven't really seen it in the numbers. You know, you'll have a day where it's good, and then the next day, before you even get your hope up, it's
Sure.
back up.
Sure.
I do think the spread of Omicron and how fast it's going through places, I have a hope that maybe it will burn itself out, but I don't think we're there yet, and I haven't seen any indication of it slowing down at this point.
In our immediate cares, the test positivity rate is still around 30%, which is a little concerning for me. We use the IHME model in order to try and predict when we're going to peak out. And so we're hopeful that February 3rd or 4th should be the peak. And then we start seeing the downside. But where we are in the curve right now, if you went on the other side of the bell curve, you're talking closer to February 20th, just to get to where we are today from an inpatient capacity standpoint, which is highly strained. So I'm very nervous about what the next 4 to 6 weeks are going to bring. And I'm really hopeful that, past that, we'll be able to be much more effective at serving the community.
Thank you. I think one of the things that you go on the website for the CDC and you look at the graph and compare Omicron to Delta, just look at the rate of incline. It's just like it's going ballistic out there, and I don't see that as holistically coming the other way. And I think everybody believes it's going to be a slow, gradual thing. And it's like trying to figure the stock market. You see the graph and past performance doesn't mean exactly what you said, doctor. You go get your hopes up, goes off, maybe goes up a tick. It's frustrating. I'd like to open up questions. Stephanie, do you have any questions? We'll try to unmute you.
Yes, I am unmuted. Thank you so much. And I would also like to express appreciation for the aldermen that are online here, Alderman Lopez, Alderman Govia, Alderman Moran. So I don't really have any question at the moment, but I'd like to pick up where we left off at the last meeting, if I may, because we said that we had a very circumscribed agenda today, which was to consider whether to recommend to the aldermen that the mask mandate due to expire on January 31st should be extended. And we said we would base that on several factors. And I want to make sure that the aldermen online who will be going back to represent the recommendation of the Board of Health, because as we've discussed before, the Board of Health does not decide, we recommend based on the best science. So the first thing I would like to say is I am extremely, I guess it's the second thing, I'm very grateful to the chief medical officers who I know are extremely oversubscribed right now for coming to give us the local update, because we promised the public last time that spoke that we would have local data. And so what we're hearing is not only do we have national data talking about the surge of Omicron, but we have local data about the status of the hospitals and how full they are. And also this coincides or is particularly poignant because we had discussed before that the length of stay of COVID patients tends to be much longer than the average ICU patient, weeks and not days. The second thing that I would like to bring up as a topic relevant to today's discussion is that the CDC just doubled down on masks. And there have been recommendations this week talking about which masks are the most effective, but that any mask is helpful. So what's interesting about the concept of extending the mask mandate is if people wear masks and we can decrease the number of cases, then that will give the relief to the hospitals. And then we can appeal to people for their own safety and the safety of those around them to continue to wear masks. But we will not be in the urgent situation that we find ourselves in now. So I believe that we have the elements we need to make a recommendation, which is that masks work and that we are still in a situation where there are risks and dangers to the community from the lack of resources at the hospitals that we need to rescue us from not only COVID, but other types of pneumonia. And as was pointed out at the last meeting, motor vehicle accidents. We've just had some storms, gallbladder attacks, heart attacks, strokes, and the like. And so what I'd like to do is make a motion to that the mask mandate be extended for an additional period of time. I would recommend that we extend it for the month of February, but that we revisit it at our upcoming February Board of Health meeting and continue to look at the data to make updated recommendations to the Board of Health. So I'm not proposing that this be indefinite, but I am proposing that we do extend it.
Stephanie, I'd like you to put that on hold. I think it's out of order at this point. There's still other people that want to talk or even ask questions. So I'm not disagreeing with you, but I think it's premature to make the motion at this point. Dr. Chuck, do you have any questions?
Oh, thank you guys for coming today. It's great to see both of you represented. And I think we've talked so much in the last year about recently about the influx of patients to the hospital. What I heard you both say was the efflux of the patients out of the hospital is just as bad and it's just as worrisome because if they can't get post-cardiac care, post-stroke care, because they're held up in the ICUs, and that's a domino effect. It may not be as relevant in pediatrics, but it's a major strain on every, all of us partners that work together to keep our patients healthy. So that was a great point. Thank you. And like Stephanie just said, that the national data is great, but unless you're in the trenches like these guys are, that know it, work it every day, and feel it every day from all the staff and everybody else providers, you just need to have that out there. So that goes a long way to hopefully quell some of the angst that I know some of the non-mask people may say about us. So I think you're that there too. The pediatric data is just as bad. There's over 1 million cases. AAP just sent out an alert to all the pediatricians just yesterday. There was over 1 million cases in the last week alone of COVID cases. And that's a 70% increase from the week before. So the children's hospitals, including Dartmouth to CHOP to Boston Children's and all around the country, are still being inundated with patient care, and the same issues evolve there. They're just as sick. They're on the ventilators, and they're staying longer in the ICUs. So it's, from babies to grandmas now, it's really truly an epidemic. So, and pandemic. So I too echoes Stephanie's comments. I think I too personally would say we probably should extend it, but I think we have 2 more weeks to be fair to the process that we have ahead of us to maybe have another meeting or review it before the end of the month just to see where we're at. I'm not hopeful that the information situation is going to be any different than we are today. But we told the public we'd have it for a month. And to that end, we're coming to the, we've got 2 more weeks of it, but I personally would say, I think that's a reasonable approach, just to kind of keep talking about it, keep showing where we're at, but we're like, it's a road race. I know Tim and I are both runners, we're not, the marathon is still ongoing, and we're maybe not at heartbreak hill yet. We've had heartbreaks, so definitely, but we're still on the incline, and we're definitely not at this point. So to prematurely say that it's time to end it would be tragic. To prematurely say that we're automatically to extend it, I think that's probably what we're going to have to do. But I think we still have 2 more weeks to see where this peak might be, and an opportunity to be fair to the process of, public awareness.
Thank you, Chuck. Lindsay, do you have anything to add, any data that
Everything
You're
that
good.
I have is
you're
reviewed.
good? Okay. Bobby? Any
I would
comments?
just add that, what we see is the peaks, and then there's that little bit of that transition before we're gonna see the impact on the hospital. So normally what happens is that, if we look at our map, we'll see the number of cases go up. And then there's that 2-week period where, depending on how severely ill people become, then you see the increase of individuals that need more acute care or emergent care at the hospitals. The idea of the face coverings reduces the amount of virus that's in our communities, and across the state, we're at substantial spread. If we can continue to cover for those that have not been exposed and minimize the amount of virus that people are being exposed to, that reduces their viral load, it reduces the amount of illness or the severity of their illness. And so I would hope that we would consider those things. And we can see the range of illness. So our doctors here can talk about the range of illness that they see. There's some that when they are infected with COVID will have mild disease. And then there are others that are not going to have mild disease. And then those are the individuals that may need to be seen in our hospitals. The more viruses out there, the more opportunity there is for the number of cases to go up for that percentage of our population. It's not just going to be our elderly, as we can see from what you all are seeing right now. And I'm sure you're not just seeing those that are over the age of 80 years old in the hospital, but it's going to be individuals that have compromised immune systems, individuals that are living with chronic diseases, individuals like myself that are overweight, because the virus tends to put me at risk as well because of that, because of how it works. It likes our cells that are inflammatory cells, it likes our fat cells, and then it goes in and does its little, whatever it does to our bodies. For as many people as we can protect from that exposure is, as a public health professional, what we're looking at with regards to the implementation of, or the continuation of, the face coverings. We need to do that, and so we need to do the face coverings, and we need to do the vaccinations and boosters, and we need to do the social distancing. So we need to do all of those things. I don't think as public health professionals, we should take away one part of that armament that we have in order to be successful like this. We've seen the numbers go up really fast because Omicron is just like that. And it may not be making as many people as sick, but as the number of cases increase, it increases that potential for that pending surge at the hospitals that we're trying to deflect, right? So by covering up, we can do that. So that if there are cases, if people are covered over, you're reducing the amount of virus in the community, and that's why we need to have the masks. Because if you have cases and you don't have people wearing masks, you're just putting more virus out there for those that have not been infected as of yet.
Thank you, Chuck.
Or follow. Thank you, Bobby, for bringing that up. Today I'm wearing 2 masks, which I've now done for 2 weeks. I have my N95 followed by my surgical mask because I just felt it was enough, along with the shield that I do with patient care. But the second point is for pediatrics is we're in the middle of our flu season, our RSV season, our chronic croupy cold season, which we're learning now, Omicron and the Delta variant for kids can present like a croup-like illness. So barking, raspy, congested coughs, and those kids get admitted. Most of the care is home remedies, but we've got sort of the perfect storm kind of going again without George Clooney. That was my joke, thank you. That just comes together at the wrong time. So we're, again, just enforcing the idea that the storm is still brewing and it's just too early to stop all the measures we're doing now.
I think that Attorney Bolton had his hand up or wanted to talk.
Thank you, Mr. Chair. Thank you. I think there may be somewhat of a misapprehension if you think you have 2 weeks to make a recommendation to the Board of Aldermen. Currently, we have an ordinance in effect that will expire unless the Board of Aldermen takes action. That ordinance will expire January 31st. Board of Aldermen have one more regular meeting before that date. That's next Tuesday, the 25th. Their agenda for that meeting closes today. So if an ordinance to extend the current requirement is to be considered at that meeting, it has to be written to have a sponsor, either the mayor or an alderman, and has to be submitted to the aldermanic office by 5 this evening. Now, there's a possibility of having special meetings and waiving the rules. They've done that for you back in December. I think you run the risk of wearing out their patience. I can't speak for them, but it is an imposition to call a special meeting and bring 15 aldermen and the mayor and the clerk and the aldermanic assistant and the corporation council out to night meetings on short notice. So if something is going to be done, it ought to be, in fairness, done today. And if you're thinking of just extending it for 1 month, I think you're going to have to consider when you would be revisiting that in February and allowing time for it to be addressed by the alderman, because they may want to invite people to come in and provide the latest numbers and make a consideration of their own based upon information provided to them. So,
Thank you, Steve.
some of this
I wasn't
conversation
aware
has
of the
been
time
going.
frame.
I think those things were not at the forefront of some people's minds.
Okay.
I would recommend thinking about. Please interrupt me. Go ahead.
No, Steve, I'm sorry that there was a bit of a delay. I appreciate your insight, and I didn't mean to jump to a motion. I assumed that there would be discussion, after the motion is made. But my understanding of how we timed these second Board of Health meetings in a month when we put them on the schedule was specifically because of what Attorney Bolton just said, because one other time we made a recommendation, missed the aldermanic meeting, and then since we had only been scheduled to meet monthly, we're not able to bring forward recommendations until the following month. So my understanding was specifically that this date and time was so we could make that agenda should we have a recommendation for them to consider at their second meeting of the month.
Okay, thank you. Doctors, do you want to add any more information?
The only other thought that came through my head, just for folks to know, is that, vaccination by itself does not seem to be enough. 40% of our current inpatient volume are vaccinated folks. And so just to make sure that everyone seems to be at risk, and I don't have numbers as to how many people are up to date with their vaccinations, but vaccinations is historically, we've documented them, don't seem to dissuade people from requiring hospitalization.
Yeah, I'm second that, saying the same thing.
Any difference booster?
Yes, but not enough.
I don't know.
Not enough, especially with the volume of Omicron diagnoses.
Yeah, it's 50-50 in my hospital for vaccinated, unvaccinated, and that's including boosted, but fully up to date.
And the only other comment that I would like to make is that the number of diagnoses that we make may be falsely low due to the number of home tests that people have that don't get reported to the state. So,
And then those people that don't need to test,
correct, correct. Right.
subacute symptoms, subacute symptoms, and just think it's a cold.
Yeah.
That's true. Questions? Stephanie, I'm sorry. Go ahead, Steph.
I don't have a question, but I appreciate Dr. Scherer's remarks. We do have some data out of Israel. As we've discussed before, they are on a single medical record, something we can only dream of. So the entire country's medical history, de-identified, the boosters, the testing and such. And what we know from them is that the boosters work, but immunity wanes, especially with the Omicron, and that every month it's a little less. And when you get out to 4 or 5 months, then it's, even less. Protects against, serious illness, hospitalization, death, but not against infection and not against spreading the infection. And our first boosters were in the September, October timeframe. So we'll be hitting up against that 4 months, right around that period of time.
Okay, thank you. If it's okay with the doctors, here you got a busy schedule ahead. Thank you for coming.
Thanks.
I
Thanks
really
for
appreciate taking the time out.
Thank you so much.
Thanks, meeting you.
Thanks.
Thank you. Stephanie, I think you have a motion.
I recommend that we submit a recommendation, sorry for the redundancy, to the Board of Aldermen for the meeting next Tuesday, that they should extend the mask mandate for a 1 month period. And then we will revisit it at our Board of Health meeting in February. And if the numbers are going down, we can make a new recommendation for them to limit it. So at that time, but I think it's easier to just recommend it for a month and then pull back rather than to say 2 weeks and then have them meet and it's another 2 weeks. It's just from communication wise. Let me clean that up. I recommend that we submit to the Board of Aldermen that should extend it through the end of February.
Thank you. We have a motion. Do I see a second to the motion? We have a second?
Yes.
Dr. Capetta. Now, discussion on the motion. Any discussion? Amendments? Seeing none, no. Seeing none and hearing none, I would call the vote. Those in favor?
Yes.
Thank you. It's unanimous. Do we have a champion that would bring this to the Board of Aldermen? Bobby?
What, we do have our liaison, I believe Alderman Melbourne Moran is on. I don't see Alderman. I'm gonna just ask Jane. Jane, can you please ask Alderman Melbourne Moran to unmute? Thank you.
Yes, what was the question? I'm sorry.
That's okay. We have a motion that passed regarding to extend the mask for 1 more month, and that the Board of Health will look at it again February, the 2nd February and second Wednesday in February, again, to see if the numbers are going down, then modify it accordingly. So what we'd like to do is extend it by 1 month.
I would endorse that.
Thank you. Could you be the person to write it and bring it to the aldermanic chambers?
Legal one.
We'll get that done.
Legal actually writes it, but yeah.
Tony, the meeting is on the 8th, so it's early in the month, the way it falls out. And also, Alderman Clee has her hand raised. I don't know what the protocol is for this meeting about inviting aldermen to ask questions or whether others will be permitted to speak. So I put that in the hands of the chair. Oh, she's saying no, thank you. She
We're
put her
good,
hand
we're
down.
good.
Sorry.
Okay, I guess we're good. This is the only order of business for the meeting, so we're off and running with that. Keep our fingers crossed that the models are correct in saying February 3rd. So we should peek out, at least we're covered till then to make sure people are safe. Thank you very much for everybody for coming, taking the time out, appreciate it. Should be the end of the meeting. I'm looking for a motion to adjourn. I have a motion, second. We have a second, we are now adjourned. Thank you very much, everybody.